we had a lot of fear across the spectrum within the community as far as whether they would want to access even private health offices, access the emergency room, access the hospital. And it seems as people are becoming more comfortable with the data, more comfortable with where the virus is, that people are beginning to seek out more care, and that seems to be apparent by the volume of patients we're seeing in the office and the response we're getting from patients when we're contacting them, letting them know that their semi-urgent surgery that could be delayed now can be done since the elective surgery ban has been lifted. So we're now moving to a phase where I would say we still do have some people in the community. Maybe they're at-risk individuals, maybe they've had some exposure, maybe they have some other fears who are still somewhat afraid, but that the pendulum has clearly swung in the opposite direction by this point.
I just saw a patient today who just had a hernia that needed to be repaired. And talking about urgent and emergent situations becoming more necessary as time goes on. He has a wife that is somewhat of an invalid, and he has to lift her frequently, and the hernia was getting worse and worse. And so he expressed to me today, as in the preoperative area, how happy he was to finally be able to get this surgery done. So I think we're seeing this across the board, that patients want to come and have this surgery done. It's not unnecessary surgery. It's surgery that needs to be done, and they've waited a long time to have it done.
Great. One thing I'll just say, just generally for the folks in the community, we have drive-through testing sites throughout the state. We do have one, and I know the hospital here has done a bunch of great testing. There's a lot of great testing going on apart from what the state's supporting. We have, at our drive-through sites, have done about 130,000 tests. We also have walk-up sites where we put, particularly in underprivileged neighborhoods, and that's done about 20,000. We've only been really doing that for a few weeks. And then obviously our National Guard and our RV. So very, very important. But with the drive-through sites, and the one in Lee County is at CenturyLink, we can accommodate a lot more than people are showing up. We did 2,200 tests yesterday. Now, granted, some of them were closed because it was Mother's Day, but I think if you look, we're typically seeing between 4,500 and 5,000 people come through all our sites. The average for the one in Lee County has been 244 people. That could accommodate 750 a day, no problem. So if people want to be tested, this is certainly one avenue that you can go, and we'd encourage people to want to come out and be tested. It's important to have access to testing throughout the state, which we've worked really, really hard on for the last couple months. We do have sites in most of the areas, certainly with any populated area at this point, but we just need more people to want to go out and get tested. And look, maybe just people don't feel sick, which is a great thing. But even if you don't feel symptoms, if you think maybe you were in contact with someone who has tested positive, or you just feel a need to, we would encourage you to come out and to get tested. So, and with that, I'll take some questions before I have to get going.
So there are people I asked with NBC2. There are monitoring social media, thousands of people who are still asking why they haven't gotten a check after 9 weeks. What could we say to them? We're also hearing about sporadic payments going out. People may be getting one or two $600 checks.
So I went over the figures. I told the folks by the beginning of the there had been close to 500,000 unique claimants paid, and there had been over $1 billion that had been paid out. But then we did hear some people say, hey, I've been in the queue. And so I asked the DEO to look at that, and I think what happened was there was just some of these folks may not have had all the appropriate information. So they worked hard to be able to get that information, and I asked them, please, process. So they processed 166,609 new claimants over the weekend, and so that's a huge amount, particularly for this system. And so over the weekend, you had 669,000 unique claimants, and they got almost $450 million. And so I would just tell people, check the bank account as today goes on. There's a whole bunch of money going out with direct deposits, and that's appropriate. We also extended the waiver for doing the 2-week recertification till the end of the month. And we did that partially because even in phase 1, it's not like the economy's 100% back. But then 2, we really want to use the system to process as many payments as possible. And if you have 500,000 people going on just to do that, when we know they're probably still unemployed, it's probably better to waive that for the time being, further waive it, and really focusing on the processing. And so I think that to pay out almost $450 million in one weekend, I think is much better progress. I mean, compared to where we were 6 weeks ago when the system was basically dead, I think that that's the type of progress I want to see. I realize it's not 100%, but I think that we've come a long way.
Governor, on unemployment, can I one more question on unemployment? So people are still, as of this morning, having trouble logging onto the website. You said, call if you need help, if you suspect that there's an issue with your account. They cannot reach people over the phone, or they're getting people over the phone.
So the system this Sunday for the weekend was the interface was removed, so you could still submit over PEGA, and the application gets processed, but it was taken down. That was by design so that the system could be used for the processing, just because at the end of the day, this is what happens is you'll have people go on, they'll open up an application, leave it open, someone else, and so you have hundreds and hundreds of thousands it weighs on the system. So that was why they've done that this weekend, and you can still apply via PEGA. I'll look into the phone, and we've got a huge number of people now doing the phone, and if there's, I'll get the call volume and see what wait times would be. But they had done a much better job recently. So if it's not 100% where it needs to be, I'll definitely take a look and have them amp up that.
Governor, as of this morning, so Fox 4, Rob Mance with Fox 4. Sorry, as of this morning, the unemployment or the rejection of unemployment claims is at 32.5% through the Florida Department of Economic Opportunity. They're advising people to reapply if that happens for federal benefits. Why aren't they just being considered for those federal CARES Act benefits on the initial application?
So just so people know, in a normal situation, the majority of people who apply for unemployment don't qualify. Now here, we do have, I think, clearly a majority, 60-some% maybe, that if you don't qualify, so say you're like a gig employee, you would not qualify under Florida law. That's just the way it goes. But you would qualify under CARES Act. So you should get pushed for the $600 automatically. Now, if you don't qualify for either, then there's this PUA, which is kind of pandemic relief for people not tied to them necessarily having lost a job, and that the money was only recently given to the states, so that's in the process of being pushed out. And so I'm going to ask DEO to put out some more information on that so people have it. But that would be something if you don't qualify for unemployment, but you still need some relief. That is what that CARES Act money is for. Now, what I think one of the things that we've seen with some, so first of all, some of the applications that people have done, employers have contested and said people had left the job and then were not fired. And then there's others where we've not found Social Security numbers. So I would just tell people, if you're applying, just make sure you put a Social Security, because like if you don't have the Social Security number, there's no way the application can be verified. It's amazing because the federal supplement to this is significant in terms of what these benefits typically would pay. It's more than you would typically do under a normal situation. So we've got people applying from foreign countries who've never even been to Florida. We've got people applying from other states who've never, that we can tell, have ever even worked in Florida. So there's just a lot of things that you have to go through in terms of fraud detection. So if you have that Social Security number, then it makes it a lot easier. One of the things I had the DEO folks do this weekend was to make sure that they were more quickly processing people in terms of making a monetary determination that had been holding some people up. I said, you got to do it quicker, and they did do it quicker, and we're able to push through a lot of folks. So, we're looking at now, we're going to be close to $2 billion, I think, as we continue to process over the weekend, and the bulk of that is probably in the last 4 weeks, once the system got a little bit better.
Two more right here.
Has that been accurate so far? Have any of the models been accurate so far?
Do you regret ever looking at the models?
What models? I guess I'm curious.
So what I looked at was I looked at the facts. I looked at the data we were getting in Florida. So for example, there would be some models that would literally come out and they would say the next day Florida is going to have 4,500 people hospitalized. And then I would look and see how many people are hospitalized. Oh, well, 1,600. I was like, all right, are we going to have 2,900 people all of a sudden? No. And so what you got to do is you have to look at hospitalization rates. You got to look at how these, the new infections, the positivity rate, but then look at it with that perspective. And I think what I found on these models is they have assumptions that are totally unreasonable, but then also they have no appreciation for how individual states are dealing with this. For example, how do you model Florida denying access to nursing homes and saying you can't send sick patients back to a nursing home versus other states that didn't do that and actually required sick patients to go back? Is that in their model in terms of how many people would end up? Obviously, I think that's made a huge difference if you look at Florida's rates versus some of these other states' rates. How do you model Florida moving to phase 1 with 64 counties and then not with, say, Miami-Dade? And I've not seen any appreciation for any of that. And so we're going to continue to go based off the facts. But look, these models, there was one model that was printed in newspapers that said by April 24th, Florida would have 464,000 people hospitalized. Now, for those who know this business, Florida's only got 70,000 licensed hospital beds statewide. So to have 464,000, that would mean you have 300,000 people who are ill and in need of hospitalization who would have no place to go. Yeah, we could build some field hospitals. We can't build 300,000 beds. That wouldn't have worked. So you're really projecting massive fatalities, 100,000, 200,000 if you really look at that. And that was something that was being printed in newspapers. What was the actual number of people hospitalized on April 24th in the state of Florida? About 2,100. So a little bit different in terms of what was projected on that. And so I think that when you go by the facts, when you actually know what's happening on the ground, when you actually understand the diverse communities that we have, when you understand how people operate, when you understand what doctors are seeing on the ground, when you understand what hospitals are seeing on the ground, that's how you make these decisions. But let's just be honest, the models have not been accurate, and Division of Emergency Management may do it, but I can tell you, I've talked with Jared multiple times about we need to go based off facts and based off evidence and not go based off conjecture.
Are there models that you look at that
Hi,
you were not?
Morgan Ryder with Link News. Good afternoon, Governor. State sales tax revenues are way down. For the month of April, it's projected to be well over $1 billion. School districts here across Southwest Florida and across the state are preparing themselves for budget cuts. What can we tell them to expect when, and might you suggest a tax cut as projected in the Sunset Coast?
So we're looking at this now. Obviously, we receive money from the Federal CARES Act. We obviously are looking to get our economy back up on its feet, which I think will be important. And so we're monitoring the collections. We also are looking to see what's happening in Washington, D.C. I specifically have put off accepting the budget or looking at the budget because I wanted to see how all this went out. Remember, we started doing 15 days to stop the spread. And that was basically, there were some restaurant limitations, bars, all that, but it's supposed to be 15 days, and then it went into another 30. And so I think that's caused a lot of problems throughout the country. In Florida, I think we've mitigated it more because of the approach that we've taken, and so perhaps we'll have an ability to bounce back. At the same time, some of these revenues are driven by things like tourism, and that obviously is taking a hit, and that's really not going to be about whether government says you can do it or not as much as it's going to be about public confidence. So we'll look at all that and see, and then once I get a sense of what's going to happen in D.C., which they are going to do something, I think, for states this week, then I'll have to look at the budget and make those decisions at that time. But I don't think it wouldn't have been appropriate for me to have signed a budget knowing that we were going to have, these uncharted waters. But it's also, now that we're in uncharted waters, I should see what are all my tools to deal with it. And I do think that you're going to see an effort on part of the federal government to help with some of these states. And fortunately, Florida is a state that is had been healthy going into this, and so whatever is done for some of these other states, if that's done for us, that's going to make it much better. So stay tuned on all that. Hopefully, we'll be able to figure out where we're going to go. I don't think we're going to need to do a special session for the rest of this fiscal year, but I think obviously looking at next year's budget, really going to be determined on what what we're looking at in terms of economic recovery, but then also what type of federal assistance that we get. Thank you.
One more question regarding testing.
Thanks, Governor. Appreciate it.